And good morning and welcome to this special community profile program for this April 28th, 2020, a Tuesday morning here. Milton Baker along with you and our guest today, Cherryville City Manager Jeff Cash and Cherryville Physician Dr. Thomas White. And thank you again, Jeff and Dr. White, for being with us today on this special program to address questions, concerns, comments, or other facts and figures about the coronavirus. So, Jeff, I'm going to turn it over to you for the first part of the show here to update us on any county or
I got on
city
the
news.
Dashboard last night through Department of Health and Human Services and the CDC, Milton, and got some current numbers. This was of last night. Globally, 3 million confirmed cases of COVID-19, 208,000 plus deaths, and there's been 878,000 recoveries. In the United States, just over 1 million confirmed cases of COVID-19. There's been 56,000 plus deaths in the United States, and 11,380 folks recovered. In North Carolina, getting a little closer to home, and there's 95 counties that are still affected. There's been 9,142 confirmed cases in North Carolina with 306 deaths as of last night. And the big thing that's news that our leaders at the state level and DHS and others are looking at the testing. There have been over 100,000 tests now completed in North Carolina, and there are 473 folks still in the hospital in North Carolina with confirmed cases. Gaston County have 133 confirmed cases during the time period, and we've had 3 deaths. And Gaston County's in pretty good shape right now, starting to see the impact of the stay-at-home order, and the numbers are beginning to fall and normalize somewhat.
We spoke just before the program went on the air here, and off the air we talked a little bit about the hospitals around, and of course the hospital in Gaston County, pretty good shape right now.
Yeah, Caramont is in pretty good shape and getting back north toward a normal population for the hospital for this time of year.
That's great news there. All right. Jeff Cash, thank you very much for the information there. Now, you wear 2 hats, of course, as city manager and as the fire chief in Cherryville. Your calls to the fire department, are they pretty much the normal routine thing these days?
Yes, they continue to be our routine calls, just had a fire alarm activated a while ago. So the fire calls and the wrecks are still normal. We have changed our protocol a bit to where we're not responding. We have emergency medical dispatch in Gaston County, as most counties do, and the calls get worse as they go up. A level is a very simple, basic transport call, all the way to E level, which is a life-threatening emergency. We're only responding to D and E level calls right now because of the COVID, and we have responded to a couple calls over the past few weeks where COVID-19 was involved.
Okay. So your folks in the fire department are out there, putting themselves at risk when it's a COVID-19 involved person, and we just don't know. Going into that situation, a lot of us would be very, very unnerved by it.
Well, we got a code when it's dispatched, if it's a known COVID case, and then our people know to go to a higher level of PPE protection, and then the paramedics typically transport, and they're at a higher level of PPE, even our police department, when we know it's a known COVID location, and sometimes we don't. They are going to a higher level protocol for PPE.
Jeff, in the past, we've talked about some public service things the fire department does, such as smoke alarms, smoke detectors, and I think we're still doing blood pressure checks at the department.
Yes, blood pressure checks. We'll do a glucose, blood sugar level checks for folks. We have kind of stopped those during the COVID, and we have actually locked our lobby door to try to prevent folks from coming in. But if there's any type of emergency, there's still people on duty to take care of them.
Sure.
We've kind of slowed down on car seat installation and stuff that ain't absolutely life or death at
Right.
this point.
I can understand. All right. Thank you so much for the update. Dr. White, hello again.
Good morning.
Good morning. Good to have you back with us here. What have you to tell us about the medical end of things since the last show on last Tuesday?
Sure. I'll start off with, I'm going to try to answer 4 questions to start off the program here. What's new with this virus? What's up with testing? What about treatment? Do we have any new ideas about treatment? And then last, where are we in this war against this coronavirus? And then hopefully later in the show or in the middle of the show, depending on the callers, I think what we would probably like to talk about is sort of where do we go from here? How do we proceed back into some normal routine of business and restoring the economy? But those 4 questions. First, what have we learned about this virus recently? I thought what I would concentrate on first is symptoms, because initially it was pretty well stated that the symptoms of this virus were cough, fever, and shortness of breath. Those were the symptoms that were focused on. And since then, in fact, the CDC just announced, even though we had some clues to this, the CDC just confirmed this week that there are probably 8 or 10 symptoms of this virus. And symptoms we didn't initially think about but have now been added would be chills, loss of taste and smell, muscle pains, headaches, sore throat, and then intestinal symptoms, nausea, vomiting, and diarrhea. And we didn't really think about those in the beginning. We thought you had to have 1, 2, or 3 of those main symptoms. We now know, as data has emerged from other countries and in this country, not everyone with this virus has a fever. So if you're using a temperature at the door to decide who comes in and who doesn't, whether it's a doctor's office or a public place, what have you, temperature is not going to be an incredibly reliable indicator. In the beginning we thought it was, but it may not be. So what do we know more about the virus and what it does. We still don't know that if you get an infection with COVID-19, are you immune and protected, and for how long? We still don't know. You may be protected for months, but would you be protected 6 months from now? That we don't know. What about testing? Certainly testing has really been ramped up. Jeff, as always, did a great job reviewing those statistics. One term that I would like to clarify, I think, for the listeners is this idea of people who have recovered. My understanding of that is that's people who've been tested, they've tested positive for the virus, they've been retested, they're well, and their subsequent test is negative. And that's that category of recovered. Sometimes that's a little unclear when you hear that mentioned on television. So as of yesterday, I think it was estimated that we've done 5.4 million tests in this country. And that's phenomenal. I do want to point out and remind listeners today that anytime you do a medical test, particularly when it comes to things like an infection, strep, influenza, there is some inaccuracy in the testing. If I do your glucose test, a sugar test, it's a number and it's pretty well close to the real thing. But with tests like these, there's what's called a false negative rate, meaning that you have the infection, but the test says you don't. So initially, the tests that were being used weren't as accurate, and they had a pretty high false negative rate. We think around 30%. Now we may be getting closer to about 10% false negative. I say this not to depress us all, but it's reality. If we've done 5.4 million tests, and if we have a 10% false negative rate, then what we are talking about is 540,000 people were told their test was negative, and in fact it was positive. So I think we need to keep improving testing, but we also need to understand what testing means. What about treatment? Well, it seems like every week we've got a new drug that may have some benefit. The latest, and I wanted to mention, was in the past 24 hours, the drug Pepcid or famotidine has been mentioned. This is a drug it's in the class of what's called an H2 blocker, a histamine type blocker. It's used for stomach acid. Drugs in that family would be Tagamet or cimetidine, and then Zantac. Interestingly, Zantac was taken off the market completely 3 or 4 weeks ago because of concerns about cancer. So in China, they've looked at their data and they've made an observation that it looks like people who took Pepcid maybe didn't get as sick and had less chance of dying. This is not a proof of any kind of treatment or cure or prevention. It's an association. I think when people probably heard that yesterday about Pepcid, they probably had one of two reactions. I'm going to run out to the store and buy as much Pepcid as I can, or they said, Pepcid, that's for stomach acid. It can't have anything to do with this virus. That's just more, that can't be true. Well, there actually may be some science behind it. We've known that drugs in that family, particularly Tagamet or cimetidine, we used it years ago for people with shingles, not because of the tingling and the itching and the pain, but there seemed to be some antiviral property to it. It's been used in chicken pox, and it's been used and still is used today for common warts. So a child, 8 years old, has warts on their hands, go to the doctor, they may try this or that, but very often cimetidine or Tagamet is used because we think it has some antiviral property. So there may be some science behind it, but I would doubt that Pepcid or Tagamet alone is a strong enough weapon to fight this virus. So I wouldn't encourage people to depend on that.
And something I read yesterday, it was you wouldn't just take a normal dosage, or patients wouldn't take a normal dosage of Pepcid. It would have to be a much higher amount of the drug that's in the product Pepcid.
Yes, very good observation. So I think in China, where they made this observation, these were people who were taking it as an outpatient when they were well, before they went into the hospital. So when they looked at the data and they said, okay, are you male or female? What's your age? What medicines were you taking? Where did you live? How many other people do you live with? They typically in medical studies, they look at all that. And it sort of popped up in the data that, taking Pepcid may be one of the things that protects you a little bit against this virus. So being female was somewhat protective. Taking Pepcid was somewhat protective. Being a non-smoker was somewhat protective. But that's not a proof of cause and effect. But you're right. When people are admitted to the intensive care unit, it's typical nowadays for them to be given very high doses of intravenous Pepcid. That's actually fairly common, and it was common before this virus, and probably still is. So the research study that's actually going on to look at this is actually going to be in the intensive care unit in someone with known COVID-19. they're going to be treating them with really high doses of intravenous Pepsid versus a substitute. And that study's ongoing, and that's a study we can get results from pretty quickly. It could be a month, and we could have some numbers from that study.
Over the last couple of months, a lot of, we're looking for the silver lining in this cloud, and some other things have been discussed, and since then have been, I guess the word would be debunked, such as the malaria drug and some other things. So we can't just, like I say, don't go out and buy the shelves empty of Pepsi at this point.
Exactly. I think we all have to be careful. I still believe that prevention and treatment for this virus may well come from an unexpected discovery, an old drug, an old vaccine, an old something, and we're going to stumble upon it and realize, oh, had we only known. I'm still hopeful and optimistic that will be the case. Okay. The last thing I get asked this a lot by folks, so I thought I would address it, is where are we in this COVID-19 process? Are we almost over this? Where are we? And so this is my personal opinion. This is no one else's opinion. I sort of still think we are, in some respects, still about halfway. Not that it's going to be as bad in 3 months or 6 months, but I don't think this virus is likely to completely go away. I think the second half will be less intense. I think it will be less deadly. I think we've made a lot of changes. I think we've done well. A lot of folks have made the observation that this virus, this COVID-19, it's not a sprint, it's a marathon. I think it probably is a marathon. And if you look at Greece, halfway between the city of Marathon and Athens is a little town called Pakermi, Pikermi. I think we're in Pakermi right now, and we're moving toward Athens. So I think that's where we are.
Sounds like a good name for a book or a paper or something. We're in Pakermi. Question either one of you, Jeff, this might be along the lines of what the county and state are doing. The term, we always come with a new term, quarantine fatigue. Anybody heard that mentioned lately? Explain what quarantine fatigue is referring to.
I had it written down to talk about.
Okay,
and we've got new terms out of the COVID-19 from social distancing and from quarantine fatigue. So there's all kind of terms. I find it interesting that like with 9/11 and the assassination of President Kennedy, Pearl Harbor, I think years from now people will be asking our generation, what did you do and what was it like during COVID-19, similar to the 1918 pandemic? So pretty interesting, and terminology evolved out of the 1918 pandemic, and now we've got terminology with COVID-19. But quarantine fatigue is what we call, my grandma would have called cabin fever.
Yeah.
Everybody's kind of getting tired of staying at home, and some good things have come out of these weeks. Me personally have become much more of a reader than I used to be. Just didn't simply have time, so I've been able to read some stuff that I normally wouldn't have read during this time, and other people exercise, whatever their thing was. They just had to do it pretty much solo or in a small group. But good news on that horizon. The county commissioners, Chairman Philbeck, has called a press conference for tomorrow at 10 a.m. in Gaston County, and they have already drawn up the plans to implement the president and the governor's phase 1, 2, and 3 phase-in of the restrictions. The exciting news is the numbers are starting to cooperate. The governor did extend it till May 8th, and there's a possibility he could extend it to May 15th. But most communities are gearing up to get back to some level of normalization, but that will be through a phased-in process, phase 1, phase 2, phase 3, that the president outlined and the COVID task force. However, those decisions are going to still be left up to the governors and the General Assembly members of each state and then handed down to the county. But Dr. Kim Eagle, our county manager, and Tracy Philbeck and our county commissioners are already on top of those plans. And tomorrow at 10 o'clock, you'll be having a press conference outlining the guidelines for Gaston County.
Dr. White, any comments on quarantine fatigue?
It's certainly real. I think there are several levels. I think there's quarantine fatigue, and then one notch above that is quarantine irritability. And you may have quarantine irritability, or your significant other may have quarantine irritability, but don't point it out to them if they do. A notch above that is quarantine depression.
I was getting ready to say,
and that's real, and that's serious, and I've been seeing some of that. And many of those individuals will say, well, I'm really not worried about the virus. I'm not worried that I'm going to contract it. I'm not worried about dying. It's partly my retirement account. It's partly the job, but it's just sort of this global feeling that things aren't right. They've not been able to go to church. They've not been able to socialize. They feel lost. They don't see any hope. And this quarantine depression is, again, it's even several notches above these others. And I worry that we're going to be dealing with that for a while, because people are going to have significant loss of not just freedom right now, but loss of income, loss of job, and loss of just a sense of security. It's what keeps most of us relatively calm and happy if we feel secure, and I think many people feel insecure.
This quarantine menace, if you will, it has many tentacles. It touches and affects so many things. Like you say, it's from job, not being able to go to work, not being able to go to church, and just this overwhelming fear sometimes of dread. I think I went through that a little bit in the very beginning. It was like, well, I could go do this, but why? You know, what's it going to mean in the next month or so? Because it was really, it's still a scary thing, but it was even more of a dark cloud in the beginning, I think, for a lot of folks, not just me, but others I've talked to. They said, yeah, they had that same feeling of dread and what's the point in doing anything, you know. But I'm kind of over that now.
On a personal note, my doctor sitting here beside me, my personal physician, should not hear this, but I've experienced that fatigue and irritability, and I usually reach for that chocolate ice cream, and it goes a long way, but I shouldn't have said that in front of my personal doctor. But some outlets like that, whatever, that's still healthy, getting out and taking a walk, social events on Facebook that folks are now doing. Last night I heard a commotion outside of our house late yesterday evening, and somebody in Cherryville had organized a parade for the graduates, and it came through my subdivision. So we enjoyed sitting out on the porch, and looking out the window at the parade of the seniors. So outlets like that's how you overcome these. But if you get to the point that it's extreme, and I'm sure Dr. White could help recommend, is you need to seek professional guidance and professional help, because it is serious.
Yeah. All right, let's tell everybody they can call in if you have a question, and you can call in. You don't have to give your name if you don't want to, but you can call in 704-435-2844, 704-435-2844. Other numbers you can use are 735-8071 or 482-1390. You call in and ask a question live, or you can text, and we'll read your question for you. If you're not able to call in, you can text at 704-473-2794, 704-473-2794, if you'd like to text in a question to Dr. White or to Jeff Cash here on the topic of the coronavirus, COVID-19 coronavirus. And we'll be with you till 11:30 today. And then I think we've planned for this to be our last weekly show in succession, but maybe come back with future updates. But this will be the last show we do on a weekly basis. So if there's anything you want to ask, this is the show to do it on. This is a show to call us at. I do have a text here, and let me retrieve it here from, this is a rather long request. A specific Cherryville question. Notice Cherryville had here we go, Jeff, car parade for seniors yesterday, which is great. But I also noticed a huge group of pictures on Facebook with approximately 30 seniors all bunched up together on high school property and pics of them hugging, etc. My question is, what do each of you say to this and your honest reaction? Second question, to parents, why would you let your kids be so, that's their words, not ours, belligerent, and then show this online? A side note, it was not all seniors in the parade. I'm sure some followed the rules. Not a good look, though. That's the question or the opinion.
I can understand that opinion and that concern, and we weren't aware of the large group gathering. We would have tried to educate those folks involved that this is still a dangerous situation and that the 6 feet social distance order is still important and still in effect. And I know for those seniors, they're going to be missing out on a lot of things that we got to take advantage of when we graduated high school. But unfortunately, it's just times where we have to be very cautious. We're not out of the woods. Dr. White mentioned the marathon and halfway. I think we're only, as I alluded to the other day, we're only about in the bottom of the 5th inning in a baseball metaphor. So we still have a ways to go, and we need to take it serious. And at the same time, I just tell people to use common sense.
I appreciate this question, and it is a delicate one. I think what we need to remember, and what I would urge our young people to remember, is that this is an unusual time in our lives, and it's an unusual year in their life. They do need to remember that the virus we've contained it fairly well. Jeff has read those numbers. We've done a good job, but that doesn't guarantee that it will continue to be contained. As hard as it is, and I understand, we're human, we're restless, we want to have fun, we want to celebrate the occasion. I think we just have to be smart and remember, let's space ourselves. If we're going to have group pictures, space ourselves 6 feet apart. Again, try to look at it as positive as possible. Won't it be interesting in 30 years to tell your kids when they look at these old pictures and you're all standing 6 or 8 feet apart and you have masks on? Daddy, why did you have a mask on? And why were you not huddled up and putting your arms around each other? Well, that was the year of COVID-19. So I don't think any of us want to remember it. I think we'd all like to forget about this, but we got to be in the moment, and you got to have your head in the moment, and we got to be careful we don't let our human tendencies and temptations take over. So again, we're all human. We're all going to do things that maybe don't look good. I've seen press conferences on television where people are standing too close together. We're all capable of making that error.
Absolutely. Let's see. Do we have someone on the line here? Hello? No. I had a call come in a few minutes ago, but I didn't think they were calling. They're probably swap shop callers. But we are with you. It's a minute past 11 here, by the way, at WCSL Cherryville. And we'll be with you till 11:30. If anyone has any questions, give us a call, 704-435-2844, 704-435-2844. As by that last text question, your question, you don't have to sugarcoat it. We're grown-ups. we can take it here. A couple things I had jotted down that have come up in the last few days. I think it was first a tiger, then 2 cats, and now a pug dog, I believe, that have said to have the coronavirus. Is that transferable from an animal like that to a human? Or how did they get it?
Right. So I'm not totally sure. What I have read and think is true is that the class of coronavirus is seen in different animals.
Mm-hmm.
We all heard initially about that it can be in bats. It can be carried by bats. So we know that. We know that coronavirus is in pigs and cows can cause infection, and typically the symptoms for those animals are different than the symptoms for humans. And we believe that this is a virus that can be transmitted from animal to human and then from human to human. And not all viruses follow that same path. So that makes sense that we've seen this coronavirus in other animals. Yeah. Makes perfectly good sense with what we've known about this class of virus. I guess what we don't completely know is what kind of contact, how close a contact with an animal must you have in order to contract this virus. I don't know that we really know that.
We know certain other illnesses are definitely transferable, like rabies and some things like that from animal to people. So this may be as well. I know from years of raising puppies in the past when I did that, and just anybody out there who has a new puppy as a family dog, you take it to the vet to get shots. When I first heard about this coronavirus in people, I said, well, corona is one of the viruses, the puppy shots, parvo, hepatitis, coronavirus, and 6 or 7 other ones were in that shot. So I thought then, well, I've heard of this corona. What's it doing in humans now?
Right. So yeah, I know someone who just got a puppy lately, and they got the papers on the dog, and sure enough, the dog had been vaccinated against coronavirus. But what I don't know is does that confer protection against this particular coronavirus or other coronaviruses? So I don't know.
We could call next door and find out.
That's right. Maybe one of our excellent veterinarians in our community would call in and tell us.
There you go. Yeah, anybody that has any insight on that.
Milton, I did
yes.
read from a reliable source that the New York Zoo had 7 animals that had the COVID-19 virus. 7 in the New York City Zoo.
So those numbers are picking up. One question that's been raised is, and we've already talked about it here, is maybe a second wave in the fall. People want to know why that is, and some notes that were in an article I read is that you'll be inside more in the fall when the colder weather comes. Flu virus or other viruses have had a similar pattern in the past of getting a second wave in the fall. School might be reopened. That could spread it. And one other is that, if I can read my terrible hen scratching here, whether the virus will, all right, I can't read what I wrote there, but just as far as maybe a second wave in the fall, what's your thoughts on that? And I'm going to try to make out what I wrote down here.
Right. So I think most experts have predicted that possibility that we may see a second wave. The question is how severe, how intense will it be? And we may likely see that in the fall of the year and the winter. And that's why I said earlier, I felt like if we were in a marathon, we were maybe halfway. It's taking that into account. It is true that seasonal influenza, tends to peak in January, February, sometimes March, and then seems to be gone in the summer. There have been all sorts of speculation about that. Does the virus simply not like warm weather? Is that it? Or does it have to do with the normal social distancing that we all do when the weather gets warm? We go outside, kids go outside and play. We don't congregate in tight areas as much. That may be a contributing factor why the influenza sort of calms down. But it is true, influenza occurs all summer. It just doesn't occur in great frequency, and we don't pay much attention. Is it the sunlight, or is it vitamin D? There have been some scientists who've speculated that maybe it's vitamin D, that because our vitamin D levels go up in the summer, maybe that has some antiviral effect. When vitamin D drops during the winter months, maybe that makes us more susceptible. I'm not suggesting folks go out and buy Pepcid, Tagamet, and vitamin D, but the vitamin D might be an issue you want to talk to your personal physician about. So I don't think we completely know how seasonal this virus will be. I think the concern, of course, is if we have a bad influenza season and a resurgence of this COVID-19, and those are on top of one another, what's that going to be like? How's that going to feel, and how much is that going to hurt?
All right. Let's stay in the medical side of things, and of course, 99% of what's being talked about these days in medical terminology is the COVID-19 virus, but people still have other health concerns. And Dr. White or Jeff, either one, do you see a reduction in people maybe looking after things like their diabetes or heart conditions, other things like that?
Well, I think there's two parts to that. One is we have certainly seen with this virus that if you have those underlying conditions of heart disease, diabetes, or diabetes that's not well controlled, it makes you more susceptible to complications from this virus. So on the one hand, I hope that this has motivated us all to take better care of our chronic conditions, and if we don't have them, try to prevent them. I think the second part of this is, again, putting it all in perspective. Once all the dust has settled, and once we've gotten from Marathon to Athens, how we're going to look at things. We have every 49 seconds someone dies of heart disease in this country, about 700,000 a year. Jeff shared with us earlier the number of deaths from this COVID-19 in this country's a little over 50,000.
56.
So with heart disease, we're talking 700,000 a year, and that's not 1 year and the next year not. It's every year.
Yeah.
Those deaths were going down back in the after the year 2000. They were going down. Now they're back on the increase. Heart disease. There are a lot of reasons. So once this crisis calms down, I hope what we will do is go back and really look at and acknowledge and take more action, that we have even bigger pandemics than this. They're not contagious pandemics, but they're incredibly costly. They need more attention. They need more action. They need research. They need money, education. I hope when we're finally at the end of this tunnel somewhat, we'll go back and realize we have other pandemics and illnesses that take a lot of lives, that cause a lot of work absenteeism, that cause a lot of heartache. We need to focus on those. We've not done a good job as a healthcare system preventing illness, and we need to do better.
Do you think people are not being tested, or just kind of, if they think they may have this COVID-19 virus, they're not getting tested, or they're not calling their doctor, they're trying to ride it out in self-isolation? Do you think that could be in part because they're ashamed to tell anybody, that they think this is like a stigma attached with having this virus? I'm not saying it is, but do you think some people are feeling that way? They're afraid to maybe talk about it, that hey, look, I think I might have COVID-19.
Yeah, well, I think there's a couple of possible explanations. I think one is I think folks probably have had some concern that if they are tested and then their name is submitted to a registry as a sort of a patient of interest, there I think probably been concerns that they will be followed as to what happens to them. I think we have a significant independent streak in us in this country, and we don't like the idea that we might be traced and followed and all our contacts known. That's sort of, I think, inbred in the American spirit. I think the second is then, what if you get tested, what are you going to do with the results? So you go get tested because you're curious, and now, lo and behold, you have a positive test. Now, are you going to quarantine yourself for 14 days? You weren't being quarantined. You were feeling good. I guess it's good that you know, but I think people might be reluctant to get tested because of the consequences of a positive test. What do you think, Jeff?
I would be concerned, and especially I would be concerned of that 30%, 10 to 30% of false negatives. You know, you go get the test and, you know, not sure that they're accurate. Certain ones are very accurate, but some are not. So my concern would not only be for testing period and finding out and being checked behind, and you are checked behind because they don't tell us names in emergency services, but if a household has COVID and it's confirmed, we know that prior to our arrival, so we have to know to protect the first responders. There's privacy issues, but then you don't want to injure first responders, paramedics, police officers, firefighters at the same time. So it's a little bit of give and take. But I also have a concern of the false negatives.
Yeah. On the subject of testing, also, I don't think we've talked about it here during the program. In Gastonia, the mobile unit that is going different locations this week, predominantly in the African American communities. Is it Kintegra, I believe is the name of the operation? Yeah.
Kintegra,
yeah.
Yes.
They're doing free testing.
Yeah, I think that's mostly in the Gastonia area. Mayor Walker Reed with the city of Gastonia helped organize that with their city staff and making some good headway with testing in Gastonia.
Yeah.
Right, and I'm glad you brought that up because I think that needs a shout out. Kintegra is formerly known as Gaston Family Health Services. They have been a major contributor to the health of our county, and they actually extend beyond Gaston County. But we know that the African American community has suffered more harshly with this virus. Their complications are greater, the deaths have been greater proportionately. And so this outreach program to go into the neighborhoods and test, I think is incredibly admirable. I read yesterday that the sophistication of testing they're using is it's cutting edge. The turnaround is 24 to 48 hours. Again, back to your point earlier about folks being reluctant to be testing, I think when you take a service out that people maybe in the neighborhood are familiar with and they trust, they've gone there for their health care needs, and now that entity, Gaston Family Health, Kintegra, comes to their neighborhood to do testing. There's a trust there. So I think it's a I think it was a brilliant idea. I think it's admirable, and I think they should have our recognition.
And I actually think we'll see more of it, even help funding from the state level to make this happen in all communities, as the money allows. The population of North Carolina, that's a lot of tests.
Yeah. Explain, if you would, there's talk on some of the newscasts. I've seen different programs and read articles about, persons who have the antibodies in the blood plasma. How is that used in research and in developing a vaccine? I'm sure it's very complicated, but someone who recovers from coronavirus, are they then in any way a candidate to maybe use their blood plasma? Or I sound like I don't know what I'm talking about, because I really don't. How would a person who has recovered from coronavirus, would they in any way, their physiological makeup, would they be candidates to help create a vaccine or drug against this?
You actually grasp it really well.
Okay.
And it's a complicated subject, but if I could break it down simple, because I understand things in simple terms. If you get an infection, you typically, your immune system recognizes that virus or that bacterium and makes antibodies. Antibodies are those proteins that help fight that germ in your body. The first antibody that we make in response to a germ is called IgM. And IgM is made by the immune system. It will stay detectable in the bloodstream for 2 or 3 weeks, and then it fades away. So IgM is sort of like a first responder. IgG then is made by the immune system, slightly delayed. It may not be made for a couple of weeks. IgG is made by the immune system, and then it typically persists in the bloodstream. So you can detect the IgG 6 months later after an infection, or 6 years often after an infection. So IgM, first responder. IgG is sort of the guard that is there for the future. The coronavirus induces a IgM and an IgG response, like other infections. And folks, of course, now part of this testing is testing these antibodies. So, do you have a positive IgM test? That would indicate that you've had a recent infection in the past couple of weeks. If you have a negative IgM but a positive IgG, it means you were infected previously, probably more than 2 weeks ago. If you have neither, it would suggest that you are susceptible to the virus and you could still contract it. So there's several parts to this. One would be using blood testing to identify who has already been infected. Let's say you were sick with a flu-like illness in December, and you wanted to know, well, maybe that was COVID-19. Maybe it was here sooner than we thought. There'll be testing done to look for IgG antibodies, and if they're positive, it would indicate that indeed you were infected. So we'll be able to trace or maybe understand previous infections by doing it. The second, we hope, is that if we can detect patients with positive IgG antibodies and negative IgM, and they don't have symptoms, and perhaps we do still do a nasal swab and a test so they don't have active virus, that person then might be able to return much more comfortably to the workplace, to the hospital, to the intensive care unit, because they have protection. Now, we need to be sure that having IgG antibodies is protective. And then that leads to the idea of a vaccine. When you get a vaccine, your body, in response to the vaccine, makes IgG, among other antibodies, So when you get a flu vaccine in September, the intent is to cause your body to make IgG antibodies then that will be protective for that particular influenza for X number of months. So we'll develop vaccines that will hopefully trigger the immune system to make an IgG antibody, which then would be protective. So vaccines are tricky. Sometimes vaccines can trigger reactions and unexpected side effects, and that's why when you hear them say, well, it's going to take a year and a half, it's because the road to a good vaccine has a lot of potholes in it, and you just don't always know when you're going to step in one.
All right. Okay, back here. We have a caller, I think, has a question. Let me get them on the air here. Hello, you had a question for our panel?
Well, it's more of a statement than it is a question,
All right,
but I'd
statement.
just like to know somebody else's opinion on it. There's a lot of testing and a lot of guessing going on about how to control this thing, but never have I heard anybody on TV. I guess it's taboo to say anything about prayer, praying for something like this.
Oh, yeah.
91st Psalm tells about this, and it's just like it's something that's going to be coming on, and it relates to us, and God has a promise for the people, his people that believes. And that if you read that, it's just a little short, it's not about a half a page, but if you read that, it makes common sense.
Okay.
That's the only thing I have to say.
All right.
I thank you for your time.
All right, absolutely. Thank you for calling. Yeah, I think there's definitely, prayer works in many cases, and I think it's probably going to be, a divine intervention in a way, using the doctors and scientists that gets this virus under control. I think we will look back and say, there was divine intervention. Look back at other things in our country, the polio vaccine and so forth. Prayer and God's hand in that was probably, I wasn't here at that time, but probably pretty relevant. Or evident.
I appreciate the caller sharing that. I would take that, and it reminds me of something I've been concerned about, and that is, at least I know in the medical world, there is, and I think it's just in society in general, there is something about a touch, whether it's a handshake, a pat on the back, a tap on the shoulder. There's something about human interaction and touching that really matters. And unfortunately, we're going to lose some of that. We've lost some of that. I know in the medical world, there have been studies done that show that if a doctor walks in the exam room and just puts his or her hand on your shoulder and says, "How you doing? Are you feeling better?" There is measurable therapeutic benefit from that. Now that sounds crazy, but people's heart rates go down, their blood pressure goes down. So one of my concerns is that I hope we don't let this lead to healthcare simply being a telephone enterprise. I hope we get back to personal contact, and then I also think we're going to have to figure out ways in just day-to-day life. If we're not going to be shaking hands, sort of how do we make that personal contact between people?
Yeah.
It may have to be a fist bump at church. It may have to be
Do the elbow thing.
an elbow thing. It may just have to be a nod of the head. But there's something very important about that with human beings.
Oh, it still feels very odd not to shake a person's hand, and I find myself thinking like, well, I'm being very rude, or not shaking hands, but this is something right now you're not. It's you're not being rude for not making contact right now. All right. We're about down to our last couple of minutes, and as we've usually done the last shows, give you this time, both of you, to make any comments or address any concerns that we maybe didn't get to in the past.
I'll go first, Milton, and then turn it over to the doc. But I just want to thank our citizens and the citizens of Gaston County and our whole region for being so cooperative. It's been amazing. Our country has pulled together to fight this enemy, and we've put in a lot of resources to it. And the great physician at Healer that was just referred to is still in charge.
Mm-hmm.
But I do want to thank all the National Guard people that's responded, the fire, police, EMS, the governments that have jumped on this. I'm sure our governor, the president, and all of his committees, and even at the local level, they're putting in many, many hours to try to take care of people and take care of our country. So I just want to thank people publicly from the bottom of my heart for their patience, their compassion, and everybody's willingness to help. We live in a great community, in a great state, and a great country.
Absolutely. Thank you, Jeff.
And I would echo that. I have great confidence that our elected officials and our appointed officials are going to do the right thing on the right schedule. Jeff alluded earlier that there'll be a press conference tomorrow to explain a little more what's going to happen in our area. What I would remind folks is I think this virus, this COVID-19, is a little bit like the game of dodgeball. Think about playing dodgeball at recess or outside. You're standing in the middle and somebody's throwing a ball back and forth trying to hit you. With this COVID-19, there's a bunch of balls being thrown back and forth and you're trying to dodge it. If you have 10 people out between those balls, a few of them are going to get hit. A few of them are going to get hit and not even know it. If there's only one person out there, they may not get hit. If there's 100 people crowded out there, you're going to hit a bunch of people with a bunch of dodgeballs. This virus is like a bunch of dodgeballs. So we've got to think about our risk, our likelihood of getting hit by the dodgeball. And then we got to think about, if you do get hit, what's it going to do to you? If you're 18 years old, you feel invincible. And in some ways with this virus, you are pretty safe. Those of us that are over 65, folks with heart disease, those with diabetes, need to be really careful venturing out in front of all those dodgeballs for quite a while. So I know as our policies come forth and how we're going to go through phase 1, 2, and 3, I think we need to think of it like a dodgeball game. It's not a game. It's very serious. There'll be some people that can participate out in the workforce sooner than others, and there's some others who need to stay on the sidelines longer until we have effective treatment and perhaps effective prevention like a vaccine. So this needs to be done carefully, and I'm confident that it will be.
Milton, I forgot to mention one group. Where would we be without the doctors, the scientists, the nurses, the people that work at the hospital, even down to the people that sanitize and clean up the hospitals and the medical centers? So that's somebody I forgot and should have mentioned first, is our healthcare facilities and all the nurses and the docs and technicians that are so diligently working in this area.
Right. Well, that's absolutely. Just in all of the work that everyone out there has done, and I feel like I've done nothing but run my mouth a little bit on the air about it. But the folks who are out there really getting involved. Yeah. All right. Thank you very much, Cherryville City Manager and Fire Chief Jeff Cash, and Cherryville Dr. Thomas White with us today. And this will be our last of our regular weekly shows. We may come back in a few weeks' time just to update things, maybe after the restrictions are eased off a little bit, kind of let you know where that stands and any updates in the medical world as well.
We appreciate WCSL Calvin, y'all's staff, Milton, for allowing us to do this the past 4 weeks. And I think I speak on behalf of the doc. We have enjoyed it. We love educating people about what's going on. and trying to keep people safe as possible. So thank y'all.
Thanks
Very
for
well.
what you do.
Very well. All right. Folks, that's it for our community profile today. Tomorrow at 10 o'clock from 10 to 11, Greg McIntyre will be here for the Elder Law Report. And in that show, they also touch on concerns for the elderly and, with this virus and any type of legal ramifications that they may have. And so that'll be coming up tomorrow from 10 to 11. We'll see you then.